we have Mrs. Aziz, and we have our warrior, Imran. How old is Imran?
It's a year and 8 months now.
Okay.
A year and 8 months.
Okay. So the first question I want to ask you is, what condition does Imran have?
Condition is hydrocephalus.
Hello everyone. Today we have Mrs. Aziz and we have our warrior, Imran. Imran, I love Arabic names, by the way. Very beautiful name, Imran and Mrs. Aziz. Thank you so much for taking the time to be here to talk to us about your journey. Yes, thank you. So the first question I want to ask you is, what condition does Imran have? What condition does he have?
His condition is hydrocephalus.
Okay.
Yeah.
All right.
From birth.
From birth.
Yes.
Okay.
Cephalus.
Okay. How old is Imran?
It's a year and 8 months now.
Okay.
A year and 8 months.
Okay. All right. So the next question I want to ask is, at what point did you identify that he probably has, some issues?
Well, when I was pregnant, they didn't tell me I was having hydrocephalus because some of my friends will tell me, some of them, they say they used to know from pregnancy that they tell them the baby head is big.
Oh, okay.
They have to operate it. But in my own case, nothing like that.
Okay.
I was just feeling somehow because I gave that to him 8 months. I was feeling somehow that day, so I went to the hospital.
Okay.
So I'm getting there, I started bleeding. So when I started bleeding, and they told me they are going to operate him out. But they did not tell me maybe he has any issue or hydrocephalus or anything.
Okay.
Nothing like that. But after the surgery, so I think he's just crying. He's just crying. Well, in the hospital, they don't put him in the light. They have one light.
The blue light.
So we just come. They brought a physician doctor because in that hospital they don't have a physician doctor. So the doctor will come and just look at him and collect money and go. I was just like, this baby is crying. What is really wrong with him? They did not have anything to say. I was just like, I can't just stay and see my baby crying without any this. So they now gave us referral letter.
Okay.
Take him to teaching hospital.
Okay.
So from there I started taking him to the hospital. From maybe it's not even up to a month. I started taking him to the hospital, but I took him to lawsuit right from 20 something days.
Okay.
They didn't answer me for the surgery until when I now came back to this place. So when it was 5 months when they did his surgery, the first surgery, even as we are sitting, I did the second one this last year, December. Okay. So the journey was so somehow because I don't even know what to say.
I understand. Sometimes you don't have words to express how you feel, right? So I want to ask you some questions from what you said earlier. At the point when you were pregnant, did you do any scan? Did you do any scans all through your pregnancy?
Yeah, in the hospital.
And they didn't pick anything?
No.
Okay.
They will ask me to do scan and I will do nothing. But me, myself, when I was pregnant, I was heavier than when I was 5 months. I'm too heavy. I will be complaining to them that the way I'm heavy, I have not, because this is not my first
child.
Yeah.
What number is he?
Number 4.
He's your 4th child. Wow.
Fourth child. The only boy.
Oh. Okay. So he has 3 big sisters.
Yes. So I was complaining, but nothing. And
because having had all that experience, you knew that this one felt different.
Yes. But I told them nothing. They didn't say anything. So see, when I just felt somehow that day, I went to the hospital.
Okay.
So that was where the journey started from. So I just noticed he started vomiting. I just feed him, vomit. I now took him to the hospital. They asked me to run tests. So from that test, they now detect that I have an hydrocephalus.
Hydrocephalus.
Calm down.
All right. So the next question I want to ask is, all his other developmental milestones, has he been meeting them?
No, although we just started this on physiotherapy.
Okay.
We just started last month.
Last month.
Yes,
Okay.
as he is now, I cannot sit, cannot do anything.
Head
on his
control?
own. No, he doesn't have the head control now. Can't do anything on his own.
Okay. All right. Just last month. I mean, from what the doctor said, our warrior doctor.
Yeah.
There are children who go through this process, and of course, they come out.
Yeah.
They're able to walk, able to feed themselves, able to do other things. So I want you to be encouraged, right? You just started. So, but I can assure you, that if you're consistent, you will definitely see results. So the next question is, where do you come from? This is Luke, right? This is Dara, but where do you come from? Where do you stay?
Abulega. Stay at Abulega.
He stays at Abulegba.
Yeah.
Abulegba. You stay at Abulegba and you come here. How often do you come here every week?
I come here twice, once in a week.
Once a week.
Yeah.
Wow. So on a day when you come, are you able to do other things that day?
No.
That's all you're able to do that day. Because even the journey of coming and going, by the time you get back, the day is almost gone. Wow. That's something. So I want to ask, how has Imran's situation, how has it affected the other children? Let me start from there. How has it affected them? How has it affected you being a mom to not just Imran, but to your other 3 older daughters?
Then I don't think he affected the other ones, but for me, he affected me a lot because I can't do anything for now because all I have is just take care of him. And I can't do anything for now because of that.
Okay. Can you paint a picture of your day-to-day life when you wake up in the morning to when you go to bed? Run us through it. When you wake up in the morning, I want you to paint a picture. Let's have an idea of what your day-to-day life is, living and, taking care of Imran, amongst other things that you have to do.
My day-to-day life is just nothing. All I do in my day-to-day life is I'll just take care of Imran. Only me. I can't really say.
Okay, so the next question I want to ask you is, are you in a community of other warrior moms? Like, is there a community that you are part of where you can, get access to resources, information, and just, encouragement, a place where you can go and feel seen, feel heard, express yourself? Like, do you have that kind of community?
Like I said earlier, I have a foundation, FA Foundation.
Oh, okay.
I do have meeting at the General Hospital at Ikeja. Okay. So we have meeting every 2 months.
Every 2 months?
Yeah, every third Saturday of every 2 months.
Oh, okay, great.
So when we get there, we express ourselves. So that is the main. We express ourselves, share our experience, and all that.
Okay. So, what are the challenges that you face? What are the challenges that you face with taking care of Imran?
A lot of challenges. I have a lot of challenges that I'm facing taking care of him. I'm the only one, nobody, and except the dad. So I'm the only one. So I have a lot of challenges that I'm facing.
So from what you said, you're not able to walk. So before you had Imran, what were you doing?
I'm a businesswoman. I'm selling everything, because I've spent everything I have.
Wow.
During the time I want to give birth to him, so for now I have nothing left. So all I do is just take care of him.
Wow. So now your husband is the sole provider for your family?
Yes.
Wow. I mean, it's I can just imagine how I can't even imagine going from a 2-income family to 1-income family, especially in Nigeria of today. Whoosh, I can't imagine. So what is his treatment currently? Besides the physiotherapy that you're on for, what is his treatment currently like? Is he on medication?
No, it's not on
It's
any
not medication, but is
yeah.
it supposed to be on medication?
No.
Okay, so it's just the surgeries, periodic surgeries, just
Yes.
to.
Yes.
Okay, okay. So basically, you come here so that you can, you know, start to learn how
When
to
I
do things.
yes, when I noticed it did not move this his hand
Okay.
and this very well. So when I complained to the doctor, the last time I came to the clinic, the neuro clinic.
Okay.
So when I complained to the doctor, they told me I should go for physiotherapy so
Physiotherapy.
that it will help me. So that was when I started physio.
Okay. You said you started coming here about a month ago, right?
Yeah, no, it's not even up to a month.
Okay.
Last month, maybe on the 21.
Okay.
There's a class.
So when you get home, are you also?
This is where I did the surgery. So
Oh,
I'm coming
okay.
here for the clinic.
Oh, okay. But
All the
physio is
time.
just
Just
recently.
last year.
Okay. So when you get home, do you also some of the things they show you here? Do you also do them with him?
Yes, yes.
Okay. Are your daughters also involved?
Yes.
They're also involved. And his father?
Yes.
Oh, that's fantastic. Mommy Imran, thank you so much for taking out the time to share your journey with us. We are really grateful. I know that it's not easy for you to sit here and tell us your story of, but I mean, that's why you're a warrior mom. That's what makes you a warrior mom.
Yes, ma'am.
And we want to encourage you that you are not alone on this journey, right? And by the special grace of God, everything you need to be able to take care of him and ensure that he gets all the best care that he can. That I know that the good Lord will help you with that, and then we in our own little way we also help you with that. All right, thank you so much.
Thank you very much. Yes, ma'am.
Hello, Imran.
Imran.
Hello.
Say hello.
Hello. Our warrior. Thank you so much.
Thank you, ma'am.
Thank you so much.
Yes, ma'am. Thank you very much, ma'am.
Yeah.